This module is going to be going over several different aspects of safety in EMS. The objectives are to identify aspects of work in EMS that pose a risk to health and or the well-being of EMS providers. We're going to identify some specific measures that you can take to protect your health, your safety, both on and off the job. We're going to discuss factors that influence transmission of communicable diseases. We're going to talk about some specific communicable diseases that should be of concern to you as a healthcare provider. And we're also going to talk about some standard precautions that you can take to protect against communicable diseases. And then lastly, we're going to talk about patient safety factors. So, some of the main or biggest safety issues in EMS are going to be motor vehicle accidents, moving patients, violence, scene safety, and exposure to infectious diseases. EMS inherently has some risk involved in it, so our main goal is to minimize the potential risk for us as providers or as caregivers. We cannot eliminate everything, but we're going to try to minimize them. For motor vehicle accidents, the most common cause of serious injury and death among on-duty EMS personnel is motor vehicle collisions. I have seen personally, I think 6 or 7, where there was one of the EMS providers were seriously injured or killed within the past 6 months. So it is a very predominant problem in EMS. So one of the things you've got to realize is ambulances handle a lot differently than your regular personal vehicle. No matter what personal vehicle you drive, unless it's an ambulance, it handles a lot differently. They're top heavy, there's a lot more weight. The weight tends to shift around depending on where the patient is or the person that's in the back. So, the big thing here, some of the things that you can do to avoid or minimize your risk for death or serious injury: wear a seatbelt. You'd be amazed at how many people just don't wear a seatbelt in the ambulance, even in the back of the ambulance. A lot of people argue that they're unable to provide patient care in the back with a seatbelt on. You can. You just have to be able to position yourself and position your equipment where you can reach it and reach the patient as well. Try it. It's a little awkward at first, but the more you do it, the more you get used to it. And I personally, I feel a lot safer with at least a seatbelt on. Some other things are making sure that you're not driving under the influence of anything, whether it's prescription or not, that may influence your decision-making capabilities. Making sure that you keep up your physical skills. Make sure you obey speed limits and obey traffic laws. And I know somebody's out there going, oh, well, we've got to run red lights and we've got to do this and that when we're responding emergency. That may be true. You occasionally will proceed through a red light. You will exceed the posted speed limits. And that's perfectly fine as long as you're doing so with due regard and due caution. Just remember, at the end of the day, if you get in a wreck on the way to help somebody else or while taking them to the hospital, you've now made more patients for somebody else and delayed care for the person you were going to help. The next big area of safety concern is going to be lifting and moving patients. Back injuries are probably the most common cause of lost work time behind MVAs, or maybe even ahead of MVAs. There's a lot of different things, and of course there's no perfect solution because there's always going to be that one patient who's trapped between the wall and the bed, and it's a foot wide and they're 2 feet wide, and there's no way to get in there good with them. So what we have to do is make sure that we are using proper body mechanics and lifting guidelines as much as possible whenever we possibly can, and ask for help. A lot of people don't like to ask for help. We need to ask for help. Don't be afraid to get some extra help in there because you're no good to somebody if you get injured. So some of the proper lifting techniques, everybody knows we need to use our legs. Lift your legs. Your arms have to be strong too. Good muscular strength is really important in EMS. No matter what your size, you can improve your actual muscular strength starting off with lighter weights and working your way up. Correct posture is another good indicator of safety or being safety-minded. If you have a curved back, if you're hunched over, you're not going to be able to engage your core muscles as well. You're not going to be able to use all of your weight-bearing capabilities of your legs. You're going to be lifting more with your back, and it's going to put more strain on your back, which increases the risk of injury there. The next big safety concern is going to be violence. You would think in a perfect world that everybody loves to see EMS come in because they know help is provide them some assistance. Unfortunately, that doesn't always happen, and in fact rarely happens. You're going to respond to situations that are just, there's inherently an increased likelihood of violence. You're going to go to domestic violence situations. You're going to go to altercations and fights and things of that nature where there's more likely to be some violence. Pay attention to your surroundings. Learn to recognize your signs of incoming or impending violence. Some of your signs of impending violence might be clenching of the fist, or maybe that sternocleidomastoid muscle that runs from down the neck, down the jaw to the clavicle. Maybe that starts kind of popping out where they're clenching their jaw or their teeth a little bit. Anger, just abnormal anger, especially anger directed at you. Any signs of violence like throwing things or holes in the wall that show maybe they have a potential for violence in the past. If they say they're going to harm you, believe them. They may not, but they may. If somebody tells me they want to kick my butt, I'm going to believe them, and I'm going to try to remove myself from that situation as much as possible. Right? Scene safety is another major safety concern, and people tend to go, BSI, scene safe, ooh, it's good, and it really is not good. We need to be in the habit of understanding that we need to understand that scene safety is dynamic. It doesn't stop as soon as you say, is my scene safe? It's safe. Okay. It's ongoing from the time you get the call to the time you finish up that call and head towards the hospital with that patient. You must think about scene safety. So, your initial impulse is going to be go directly to the patient. Okay, safety first though. Yours, then your coworkers, then your patient, then bystanders. That's the major order of scene safety. In order to ensure your scene is going to be as safe as you can make it, you go through a process, and that's called scene size up. And a lot of people run through it and don't really think about what it means, but you should. So the parts or the components of scene size up that you really want to pay attention to: personal protective equipment, PPE, BSI, PPE, right? With PPE, what do you need? We'll talk a little bit more in a little bit about your different needs for PPE, but what is the probable illness or concern here, and do we need some specific PPE for this call? Okay, any safety gear, barriers, things like that. All right. Anytime that somebody's been injured, you have to think about, is that risk of injury still there? All right, or have there been other risks created, such as a wreck, an MVC? Inherently, an MVC is going to be a potentially more dangerous call. Not only do you have the initial wreck, what caused the initial wreck? Were they fighting? Did somebody have a heart attack? Or were they not paying attention? Do you have angry people that were involved in the wreck that may be angry at each other, saying somebody else caused the wreck? When they had the wreck, did they hit a power pole? And when they hit that power pole, did it break in half and now there are power lines down? Well, now we've got the risk concerns from the wreck itself, broken glass, twisted metal potentially. We've got bystanders driving by because everybody knows they do the whole rubberneck looking and seeing what's happening. And now you've got the added risk of potential electrical concerns because the power lines are down. So not only do you have those initial safety concerns, but you've also got additional ones that have been created from that problem. Now that's a somewhat specific, maybe even exaggerated potential risk, but there are other risks even in just a general run-of-the-mill, I don't feel good, or transfer call. You walk into somebody's house and it's cold. We don't have this problem here in the South, but maybe up north, maybe you slip on ice and fall and break your arm. Or maybe you go in and they've got a loose rug or a cable running across the floor and you trip over it. I'm queen of clumsy. I know about tripping on stuff, so I know to look very carefully when I'm walking around doing things. So always be vigilant to see what could be the potential problem or any hazards. Be almost paranoid about it, and it helps keep you alive and helps you make it home at night. Now, as far as mitigating your scene safety, if you can make a scene safe without what they call unreasonable risk, that really depends on you. What is unreasonable for you? What level of risk are you willing to assume or is reasonable to assume? If you can do that, do so before caring for the patient. Make it safe. All right? If you can't make a situation safe, don't go in. Don't approach the scene. If you're already in a scene, try to get out to get to safety. All right? If you can take the patient, awesome. If you can't, get yourself out, because if you become another victim, you are not going to be any good to the patient, and you're going to create more work for somebody else. All right? In order to make that situation safe, if you cannot do so, you may need some special assistance like law enforcement, animal control, the power department, something like that. Now, exposure to infectious diseases. This is both one of the greatest safety concerns and least cared about things that I've seen in EMS. Everybody knows that it's there. Everybody knows that they don't want to get any of the cooties, as they call them. But people don't always take proper responsibility for PPE. They don't think about it, I think. Now, OSHA enforces regulations that require employers to provide certain types of PPE to workers in certain jobs. In EMS, part of that required PPE might include N95 mask, some kind of clothing barrier, safety protection for the eyes, like goggles or mask or face shields, and most definitely the one that most everybody thinks about is gloves. So those are required to be provided by your employer for you to do your job. Now, the CDC issues guidelines for your healthcare workers, recommended immunizations, and the proper use of PPE and standard precautions. Now, you will see in the modules that there is another, I have linked this CDC PowerPoint for all of their in-depth PPE and standard precaution guidelines. Now, your standard precautions in general, that assumes standard precautions assumes that a patient's blood and or bodily fluids could be infectious. We don't know who has what disease, and a lot of times the patients don't know what diseases they may or may not have. So our job is to treat every single bodily fluid and every potential blood that it has something we don't want in it. And gloves are your most frequently used form of PPE, which is good, but there are still people out there who don't use them. And we're going to use non-sterile exam gloves for most of our routine patient care and patient contact. CDC's recommended immunizations for healthcare workers include hepatitis B, which is a series of 3 vaccinations, the flu annually, MMR, and they do also recommend titers to be drawn periodically, so that way you can ensure that you are still immune to these diseases. And if you are found to not be immune, then you can always get a booster shot for the majority of these vaccines. Varicella, which is the chicken pox, and once again, if you had chicken pox as a child, then they can draw titers to see if you are in fact immune to it, and if you are not, you can receive a booster vaccine for varicella. Tdap, which is tetanus, diphtheria, and pertussis, and they recommend that you, if you're going to be working with newborns frequently or around very small children, that you get an update booster for your pertussis. And then occasionally your meningococcal, which in certain settings, this is more of the long-term care, like say nursing homes or something like that. So how can we reduce our risk for safety issues? They're there. They're not going to go away. Our job is to reduce the potential to encounter them. So the number one way to reduce disease is to wash your hands. It's something so simple. There's soap and there's water just about everywhere you go. Wash your hands. Wash them properly. You should take your watches off. You should take your rings off. Now, me personally, I don't wear I don't wear my wedding rings, my wedding set when I work. I wear no rings at all because I don't want to get any nasty boogers in my rings. A watch, I don't wear my expensive watch. I wear a cheap $10 Walmart watch because if it gets really gross, I'm going to throw it away. So I like to make sure it's something I can completely submerge in warm soapy water and actually clean and or disinfect if I need to, or throw it away at the end of the day if it comes down to it. We should be washing in between our fingers, underneath our fingernails. In fact, avoid artificial nails. If you wear artificial nails, those are like a little hotbed for bacterial and viral growth. They're really gross under there, so you probably should not do that. Warm soapy water. Use soap. Soap's not going to kill everything, but it will kind of lubricate the surface of your hands, making it easier to wash away any bacteria, viruses, anything that might cause you harm. All right, wear appropriate PPE for all calls. You wouldn't I hope, go into a residence where you know someone has tuberculosis who's coughing without a mask on. Well, we don't always know who has tuberculosis, so treat it like they have something you don't want and wear that appropriate PPE. You don't want to get somebody's blood or vomit in your eye. It's just not fun. All right. You want to make sure that you clean and disinfect the ambulance and your equipment routinely and after every transport. I like to say, would you get on that equipment? Would you lay down on that board? Would you lay down on that stretcher? Would you sit on that bench seat? Would you put on that blood pressure cuff? If you wouldn't, you need to do some more cleaning and disinfection. Not only is that for our safety, because we're going to be handling all this equipment as well, but also for our patient safety, because a lot of our patients are going to be immunocompromised, and so what might be just a small, insignificant virus to us that our body fights away could kill them. Right? Proper handling of sharps and contaminated items. That seems like a no-brainer, but people don't know how to do it. So we don't want to handle it barehanded. Any sharps need to be disposed of in a hardened receptacle that's marked for sharps disposal. Any kind of contaminated equipment, like say a laryngoscope blade or something like that, does not need to be handled with your bare hands. It should only be handled with your gloves, and it needs to be dealt with appropriately. You want to avoid any kind of jewelry, artificial nails that can trap microorganisms and keep them in there. You don't want to eat, chew gum, or put on any kind of makeup or chapstick in the patient area. Now, some people may do this when the patient's not in there. It's recommended that you not, because there's still going to be, no matter how much you clean, it's never going to be completely sterile. And so everything you eat or chew, put in your face and your mouth, could come in contact potentially with some sort of virus or bacteria in there that could cause you illness. The Ryan-White Act is a very, very important act. It was instituted in 1990, and then it was reauthorized in 2009. So the full name is the Ryan-White Comprehensive Aid Resources Emergency Act. And what this does is it requires that all emergency response personnel, including us EMS providers, must be notified when they've been exposed to a patient with an infectious, potentially fatal disease such as HIV, hepatitis, things like that. So this is a really good thing for us. This requires them to notify us so we know if we need to get tested or not. It also helps you kind of bypass any potential HIPAA violations by them sharing their personal information with you, because generally that would be non-disclosed. But if you have a reason, a concern, if you got a needle stick or something like that, then they will release that, or required to release that information to you. Now, as far as your contaminated equipment and your surfaces, you've got surfaces. There's several different ways that they can be handled. The first one is going to be disposal. A lot of your things, like your invasive personal care items, your IV catheters, airway devices, needles, syringes, bandages, suction, things like that, those are all meant for single use only. Those you throw away when you're done. So that way you're not exposing other people to whatever that other person had. All right. Your sharps need to go in a special puncture-resistant biohazard disposal. Everything else, if it's not sharps, generally will go in a red bag or biohazard special bag that gets handled in an appropriate manner. Now, cleaning, a lot of people kind of mix up cleaning and disinfecting. Your cleaning means that you're washing something with some kind of soap and water to remove gross debris, and not gross like ooh, gross but it's like big chunks, things that you can see. So this is basically just washing. All right, so you're just washing away things that you can see, but there's still microorganisms there on the surface or in the equipment, which leads us to the next one, which is disinfection. Disinfection is for things that are not used for invasive procedures like backboards, stretchers, mattresses, splints, things like that that are not single use but have potentially come in contact with some blood or bodily fluids. All right, disinfection is going to require the use of a commercial grade disinfectant or solution of 1 part bleach to 10 parts water. And that is something that we can do in the field. You should have the appropriate equipment to do so. The next one, sterilization. This is something that you're generally not going to be able to do at the service, but usually is going to have to be contracted out. So sterilization is using pressurized steam or chemical sterilization solutions to kill all the microorganisms on an object. All right, so any items that are reusable and will come in contact with a mucous membrane or non-intact skin, like a laryngoscope blade, should be sterilized or needs to be sterilized. You would need to check with your local agency to see how they handle that process. Most of them are going to contract out with a hospital or other agency to sterilize their equipment. Now, as far as an exposure, because this is one that we are usually fairly concerned with, but if you are exposed to something, now there, okay, so contamination is where you have potentially infectious material that comes in contact with your clothing or your skin. If it comes in contact with your skin, you need to immediately wash the area with soap and water. Okay, if your clothing is contaminated, you must remove and bag it, shower, and put on a clean uniform. And then that contaminated uniform needs to be laundered by a service or at the station. Don't take it home and put it in your washer and dryer, because then whatever's in those clothes is now in your washer and dryer potentially. You don't want that. Okay, now an exposure is going to be where potentially infectious material comes in contact with either a mucous membrane or a non-intact skin. So this would be such as contaminating of existed wounds, needle sticks, cutting your hand on a piece of glass during extrication, something like that. So for these, you're going to immediately wash your area with soap and water. Okay, if your eyes are splashed, you're going to irrigate for up to 20 minutes with water or saline. Okay, which that sucks. I've had that happen. I had a patient vomit in my eyeball, and it was very, very painful. Report that exposure. And a lot of people don't report things because they're embarrassed, or they're afraid they're going to get in trouble, and that's crap. Report the proper person, follow your guidelines, and seek medical care, because if you don't, you're on your own. If you get this, if you develop this disease, you're on the hook for it, and you're going to be dealing with it probably for the rest of your life. If you follow your proper reporting procedures, then you may be able to get workman's comp or have assistance in dealing with it, or potentially not have to deal with it at all. Maybe get ahead of it and take proper prophylaxis. Now, as far as your disease transmission, there are several routes of disease transmission. The two primary are going to be direct and indirect. So your direct transmission, you have to have your infected person and your non-infected person in very close proximity. An example of this would be HIV/AIDS, which is spread through bodily fluids. So you have to have close proximity to the blood or bodily fluids of a person who has it. Now, the other way, indirect, this can still be through, it's going to be from your non-infected or your infected person to your non-infected, but there's an intermediary, okay? So like hepatitis B can live on surfaces for up to about 2 weeks. So indirect, if somebody bled and it was not cleaned properly, and there was hepatitis B on a tabletop, and then you had a cut on your hand and you touched that tabletop, you could potentially develop or contract hepatitis B from that, even though you didn't have direct contact with the person who has the disease. Now, another form of indirect is going to be with a animal intermediary, which is considered to be a vector. The most common example of this is going to be like mosquitoes. They transmit quite a few different diseases or viruses. Right? You can also have an inanimate intermediary, such as a contaminated piece of medical equipment. Maybe somebody used a laryngoscope blade, didn't clean it, and then it was used a couple hours later on another person. And so that is called a fomite. When you're looking at your characteristics of disease transmission, there are two really big things. The next two routes that they kind of break it down with are respiratory and bloodborne. So of course your respiratory is anything that is spread through the respiratory route, such as the sputum, droplets, coughing, things like that. All right, and these little droplets or particles are then inhaled to the respiratory tracts of nearby individuals, spreading the disease or potentially spreading the disease. Now, your bloodborne pathogens are transmitted from one person to another through the exposure of your mucous membranes or non-intact skin through your blood or bodily fluids. All right. Another form is the GI tract. Some pathogens enter and leave the body through the GI tract, such as hepatitis A. If you're changing diapers or something and you don't adequately wash your hands, you can transmit it that way. Other diseases are spread through sexual contact primarily, such as chlamydia and gonorrhea, or through birth from the mother to the newborn. Now, it's important to note, not all contacts with a pathogen are going to cause disease. There's a lot of different things that kind of factor into whether or not they will develop an infection or not. Characteristics of the pathogen that influence this are the virulence and the dose. Virulence is the strength of the organism. It has to be strong enough to cause that infection, to overwhelm the immune system. And then dose is the number of microorganisms. If you come in contact with one single HIV virus, the odds of infection are not good in the average person. However, if you come in contact with 1 million HIV viruses, the odds go up substantially there. And as far as characteristics for reducing your infection for your people, having good health, environment, good ventilation, sunlight, things like that are all working against the microorganisms to cause infection. Now, some specific diseases of concern: HIV and AIDS. So this is probably one that most people are familiar with, and what it does is it suppresses the T cells and immune system. Transmission is blood or bodily fluids, including intravenous drug use and sexual contact, and is very rarely transmitted via needle stick. Your prevention: standard precautions for anticipated contact with blood or bodily fluids. So if there's any potential for spraying bodily fluids, you want to cover your eyes, you want to cover your face, your mucous membranes, your gloves. Right? For hepatitis B and C, blood, bodily fluids, and contaminated objects. Standard precautions for any contact with blood or bodily fluids, and disinfection of contaminated equipment surfaces. Tuberculosis, primarily respiratory, but can be present on contaminated surfaces. Right? Transmission typically requires prolonged close proximity, such as prisons, extended care facilities, things like that, but you still could get it even on a shorter transport. So your standard precautions here: use of an N95 respirator for known or suspected active TB. Disinfection of surfaces and equipment, and routine TB skin testing to check for exposure. They recommend once per year. And if you ever have a positive test, then you will need to have a chest x-ray. All right, bacterial meningitis. All right, oral and nasal secretions. So standard precautions, including a face mask for the suspected disease. Pneumonia. Respiratory, oral, and nasal secretions. Standard precautions, including a face mask. Staphylococcus. Skin contact with open wounds or contaminated objects. Standard precaution and disinfecting and frequent hand washing. Flu. Primarily seasonal, but respiratory droplets or direct contact. Standard precautions: hand washing and disinfection, and vaccines. For your pertussis, respiratory and or airborne, they recommend standard precautions, including a face mask, and to update your vaccines. Now, your PPE recommendations. The CDC recommends that you use gloves whenever you are touching blood, bodily fluids, secretions, excretions, contaminated items, for touching the mucous membranes and non-attacked skin. So pretty much in EMS, anytime you're going to be doing anything. All right, they recommend gowns used during procedures and patient care activities when contact of clothing or exposed skin with blood and bodily fluids, secretions, or excretions is anticipated. These are very, very underused. We don't have them out usually unless you have an OB kit out. But they do recommend that you use them anytime there's potential for blood or bodily fluids. Now, mask and goggles or a face shield used during patient care activities that are likely to generate splashes or sprays of blood, bodily fluid, secretions, or excretions. Once again, that can happen a lot. I'm a big fan of goggles because I've had vomit in my eye one time and I don't ever want that to happen again. So I highly recommend that you get used to find you some goggles, or order you some good ones that you like and that you'll wear, and then wear them. Now, as far as your patient safety concerns, there are a couple of different high-risk activities where problems or concerns or errors can occur. So during the handoff, when you are turning over care, you want to make sure that you communicate all important information to the person that you're turning over the care to. What medications that you've given them, any important history, things that we may not be able to give to them later. Right? There are communication issues. If you tell them to do this and they do something else, when you leave somebody at the house, if they refuse care, you always want to make sure they know that they can call back 911 if they need to. Otherwise, it's a huge liability. Medication issues. Triple check yourself on medications. Medication errors kill a lot of patients every single year, not just in EMS, but in general. So it's avoidable. Make sure that you're calculating that dose correctly. Make sure that that concentration, that medicine that you're given is the same concentration that you're used to. Make sure that you're giving the correct dose. Make sure it's the right drug. Sometimes the drugs may be packaged a little differently than you're used to seeing, and now the color's changed and it looks like something else. Make sure that you know what drug you're giving and how much, and that you're giving it the right way to the right patient. Now, dropping patients unfortunately does happen. Goes back to what we were talking about earlier. Make sure you ask for help. Get adequate help to move the patients if you need them. It's better for you, it's safer for you, it's safer for the patient. Right? Big thing here that you can do to avoid this is to communicate with your partner or whoever else is helping you. Make sure the expectations are clear. Make sure that everybody understands when you're going to lift, how you're going to lift, and what you're going to do once you lift. Of course, ambulance crashes, we talked about that. Make sure that you are awake. Make sure that you aren't under the influence of any mind-altering substances. Make sure that you're following the rules of the roadway and not driving like a bat out of Hades. And then spinal immobilization. This is one of my personal soapboxes. If you're going to do it correctly. A lot of times people like to use your emergency moves or urgent moves when in fact there is no need for that, and they do it improperly, so people get hurt. We cause a fair amount of spinal injuries that are completely unnecessary. So if you're going to spinally immobilize a patient, do it the proper way.